So my father's actually a physician as well, and I grew up in a small town, and I saw the commitment that he had to his patients and to the local community. And for me, that was, observing something that was a calling and a career. And I liked the aspects that you could provide care to patients, but that it was a career and a calling. And so that's why I chose medicine in general. And then I liked pediatric and adult patients. I knew I wanted to see all ages. And so I decided to do the dual residency program where you can actually become a specialist in both internal medicine and in pediatrics and be board certified in both. So my philosophy of care is that I really want patients to leave the office understanding what happened. There's a statistic that 60% of patients actually leave the doctor's office and have no idea what just happened in terms of what their diagnosis is, what medications were changed, what labs happened, what the next steps in care are. And that's a terrible statistic. No patient should have to go through that or with their families. So my goal is to really have this partnership with patients and their families if they want, so that they can understand their health care and subsequently have better outcomes from it. One of the reasons I love being a physician, it's hard to put one thing on it. I think at the root of primary care, which is what I do, is the love for the patient relationships or relationships that I can build with patients and their families. I think that it's hard, it's trust. It takes a lot of trust to build a relationship with patients and their families, but that after that happens, you can develop these wonderful relationships that can last years and decades, and that has better outcomes for the patient. It makes the patients happier, it makes me happier. And when everybody's a partner together, it serves for the good of everyone.